Weight loss success secret number 1, insulin resistance. Insulin resistance is rising with epidemic proportions. First off, you might wonder, well, what is it really? According to PubMed, insulin resistance is a state in which the body cannot use insulin effectively. Insulin is needed to help control the amount of sugar in the body. As a result, blood sugar and fat levels rise. When eating a high carbohydrate diet, it will cause harmful spikes in insulin levels. After a period of time, the locations that insulin activates, known as insulin receptors, will become desensitized or unresponsive to insulin. What happens is that the blood sugar that your cells need to make fuel, ATP, is not adequately getting into the cell itself. This allows more glucose to stay in your bloodstream and allows for water retention, leading to increased weight. It can also cause fatigue, peripheral neuropathies, and what's called metabolic syndrome. Now, metabolic syndrome is a name for a group of risk factors that occur together and increase the risk for coronary artery disease, stroke, and type 2 diabetes. According to the American Heart Association and the National Heart, Lung, and Blood Institute, metabolic syndrome is present if you have 3 or more of the following. So, blood pressure above 130/85, fasting blood sugar above 100, a large waist circumference, so men it's going to be 40, women it's going to be 35, low HDL cholesterol, so that's going to be men under 40, and then for women it's going to be 50. And then triglyceride levels equal to or higher than 150 milligrams per deciliter. Now, there are tests that may be done to diagnose metabolic syndrome. These include, again, blood pressure, glucose testing, HDL, LDL, total cholesterol, and triglycerides. So all but the top 2 can be classified as a lipid test. As you can see, this might be a huge factor for you. It might be the reason you cannot lose weight in addition to setting yourself up for major health problems in the future. I plead with you to get proper lab testing done and see if this is impacting your health. The good news is that this vicious cycle can be changed.